I had case 2 of the female 20-year-old college gymnast, but so what I was thinking is that the patient had medial elbow instability with probable UCL damage, and judging that she didn't have any pain with MMTs or active and passive range of motion, I thought that it was probably beneficial to start strengthening right away. I didn't see any problems with doing that, as long as there was no need for immobilization first. So if there was need for immobilization, I would immobilize for 1 to 2 weeks and then start with this progression. So the first exercise that I wanted to show was to strengthen the flexor mass of the forearm. Like I said, I know she's having medial elbow instability, so 2 muscles that we can strengthen that will specifically help with that instability are the flexor carpi ulnaris and the medial head of the triceps. So to start, I'm just going to have the patient use a TheraBand for the wrist flexion exercise, and just going to place in their hands, and I'm just going to have the patient flex their wrist and alternately deviate, leading with their pinky. And I would have the patient do this roughly 2 to 3 sets of 10, judging on their tolerance, 2 to 3 times a week. And then I would progress with a higher rep, low load, up into a higher load, lower rep, as the progression keeps going forward. The next exercise, as I said, will strengthen the medial head of the triceps. So we're just going to do a simple tricep extension. With the TheraBand again. Again, just starting with low load, low reps, and then just progressing through the normal strengthening progression of lower load, higher reps, and then higher load, lower reps. Alright, so I'm just going to have the patient stand in front of the TheraBand, grabbing both sides, elbows down by the side, close to the body, and then I'm just going to have the patient extend their hands towards the floor. Good. Alright, good there. Alright, the next 2 exercises that I'm going to have my patient do, the first one's going to be a bird dog exercise with in the plank position, and the reason I do it in the plank position is so there's no increased weight bearing force through the elbow, pushing it into that hyperextended and valgus position. So I'm going to have my patient get in a plank position on the ground. It doesn't matter. And then I'm going to have them bring up one arm with the opposite leg. So if the patient brings up their right arm with their left leg, go ahead. Then back down, and then opposite. Good. And I'd probably have the patient do this for roughly 10 times for 3 sets. And the purpose of this exercise is just to help strengthen or keep those core stabilizers strengthened, as well as shoulder girdle muscles. And we're even getting a little bit of lower extremity in there as well, which is probably important as a college gymnast. And then the last exercise that I'm going to do is, it's essentially like a shoulder tap technique with the patient leaning up against the wall. I know I said here that I went into the plank position to decrease the weight-bearing load on the ground. But this time we're actually going to have the patient's elbows extended, full weight bearing through the wall. And the reason I think this is acceptable is because in the upright position, the weight bearing load through the elbow is a lot lower than in a quadruped position on the ground. So I'm going to have my patient do that now. And generally here, here we're going to have the patient do 10 reps to each side, and again probably 3 sets of this. Go ahead, lean up against the wall. And then right arm to left shoulder, shifting your weight onto your left shoulder. And yeah, you can go ahead.